So welcome to the presentation today. My name is Dorcas Beaton. I'm one of your co-chairs of the Technical Advisory Group at OMERACT and the Handbook Group. And welcome to a discussion about instrument selection the OMERACT way, a guide to the processes used for instrument selection developed at OMERACT, but usable anywhere. Just to remind you that a core outcome set at OMERACT is made up of two things: the core domain set, or what should be measured, and then the core outcome measurement set, how we should measure it, what instrument should we use. So today we're going to be speaking about the core outcome measurement set and how we would go about selecting an instrument for that. Overall, we're developing a series of presentations like this to help introduce you to the different OMERACT processes for selecting outcome instruments for the core outcome sets in clinical trials. And our objective today is to really get you involved in the whole process and to really reinforce some of the OMERACT principles that are at play in the process. For example, we encourage the engagement of key stakeholders right from the beginning. They have great insights. They can help with the buy-in of their colleagues or the broader community in your work. And they see opportunities for improvements and dissemination of the results of all of our work. So your working group, as you're starting out, needs to include patients and fellows in your core steering group. And usually working groups have some sort of a smaller group that's actually doing a lot of the work, and then they go to their broader work and try to get help with interpreting the results and getting feedback. So when we're talking about the core or steering group, we mean this smaller part of your working group. So the objective today is to describe the process that can be used for an evidence-based instrument selection, hoping that by the end of it you'll walk away with a sense of what you need to be able to do to decide on an outcome instrument. And we call this the OMERACT way, and the three pictures in the hand of the red figure in this slide will show you the three tools that you'll become familiar with by the end of this presentation. The OMERACT way card, which is available for you at any point in time, the summary of measurement property instruments table, the table in the back, and then to the right, the checklist to monitor your progress through the process. So we used to always talk about making it through the OMERACT filter when we talked about an instrument. And we talked about the three pillars of the filter: truth, feasibility, and discrimination. So where are those pillars? Well, in truth, they're still here. This is the OMERACT filter instrument selection algorithm, which we'll be following through, and it's following those same three pillars. It's looking to make sure that an instrument is truthful, and that's been split into two of these signaling questions you see in the chart on the right. Is it a match for the target domain? And do the numeric scores make sense? Both of those reflect truth. Feasibility, is it practical to use? And then discrimination, the bottom signaling question, can it discriminate between groups of interest? You'll be giving it a red, an amber, or a green rating, and we'll be going through that in a little bit more detail. But one important point here is that you'll see that there's a line separating the first two questions from the last two. And we'll dig into that a little bit more, but just for here, it's saying that if you get a red, a stop, for either the first two questions, you needn't go further into a more detailed review. You can be confident that that instrument should not be endorsed for the filter because it doesn't match the domain or it's simply not practical to use in the context of a clinical trial. So practical things come first. So when we think about the OMERACT way, it's really a process. It's made up of several steps, and we'll use this OMERACT way card to guide us through those steps. The first step is really to make sure you understand what you're trying to measure. And that means you're already reliant on a domain set. Before you get into instrument selection, we've already decided on what domains should be measured. So go back to those domains. Go back to your OMERACT onion, and for each of those domains there'll be a definition and some examples, and really trying to flesh out what that should look like. So when you're starting instrument selection, go back to that domain and remind yourself what it is you're trying to measure. Refresh your context of use too, exactly what patient population, what types of interventions, or any other factors you think are really important in driving the instrument that you're selecting, and the setting in which you're going to use it. So for example, today we'll use an example of pain intensity. So the definition might be the severity or intensity of pain sensation from no pain to the worst possible pain. And perhaps the working group has decided that the best time frame for that is over the last 24 hours. So that's our working definition. We've gathered our team together. So you name and engage your stakeholders. You create your team at this stage. Decide on how you are going to approach each step in the process. Patient partners and fellows must be in the core group, and other stakeholders should be engaged early. They can help with setting up the question, looking over your search criteria, making sure you've targeted all the key articles that they might know about, setting your selection and screening criteria, and then of course at the end an interpretation. And once you get that all together, submit your protocol to TAG for approval. Now you'll notice now we've got a workbook that should you decide to follow the approaches that are described in that workbook, pretty much step by step, then you can just tick off a box to say, I'm going to be following the standard approach, and you'll be done. However, if you do wish to make some changes, which is your choice, then you need to submit that to the Technical Advisory Group, or TAG, just to make sure that we can ensure that you're likely going to have a very successful effort. So then you start picking up your instruments. And for pain intensity, let's consider the numeric rating scale, a simple single item question. And you look at it. And this is the same if you're looking at something like joint counts or disease activity index. Look at the actual scale and see what it's looking at. Does it look like it's a match to your target concept? So how would you rate your pain over the last 24 hours? From no pain to worst possible pain. Pretty close match. So let's say for pain intensity, we'll be considering the numeric rating scale. And this is what it looks like. So it's a single item questionnaire, a 0 to 10 scale, there's some words across the bottom, and it asks about how you would rate your pain over the last 24 hours. So we'll use this for an example as we move through the different steps in instrument selection. This will be our sample instrument. So as you can see, what we've started with now is we've already done the first 2 steps in the OMERACT way. We've reviewed our domain and we've pulled out an instrument that we'd like to consider. And the next 2 steps are checking to see whether it's a match for our target domain, the first part of truth. And then secondly, really reviewing if it's practical to use. And both these steps are very practical assessments. They're often done by the working group, hopefully with a little bit of data in hand so they can check some of the content, ceiling and floor effects, for example. But it's really saying that the very practical things are coming first. So is it a match with your target domain? Check with your team, but also talk to people, talk to patients, talk to your stakeholders, talk to the person who's going to be responding to the questionnaire, and make sure that it's a match to their lived experience. Is it practical to use? And this is where we do an assessment of the time, burden, costs. This can be rated by the group, but it should be as transparent as possible, recorded in your workbook. But to help you along, we've also developed some tools or brought instruments in that are available in the literature to help you with how you could look at feasibility. This is when we start using the traffic light scoring. So you'll be rating the concept match and the feasibility on this red, amber, and green. So across the board, red always means stop. Don't use this. Don't go any further. Amber means caution, but you can continue. So things that get an amber rating can still continue with OMERACT. Usually it's a little bit of a flag for caution. And then green means it's good to go, that it's past that question. White, we'll encounter a little bit later, means an absence of evidence, that there's no evidence at all. And that, along with red, would be something that cannot pass the filter, because we do need to have the evidence for each of our key features. So now we've decided that both the concept match and whether it's practical for use get a green rating, good to go. So we could record that on the OFISA, and we should record it on the instrument checklist, as you can see below. Okay, so now we're moving along our OMERACT way. We've done these stages, and this is now a key step, because what we're saying here is once you've assessed the concept match and the feasibility, set aside instruments that are not feasible or don't match your domain definition. And this is often quite a number of instruments. It doesn't mean that it's a bad instrument, it just means that it's probably a bad fit for your intended use. So set those aside before you go any further, and document why you've set them aside. Also document that your whole working group has agreed that this is an instrument that should be set aside. We now go into the evidence searching part, where we try to find, and in OMERACT, we allow creation of evidence to meet the filter 2.1 requirements. And by that, we're going to use the literature and what's available in the literature about the performance of the instrument. But if a gap is identified, for example, perhaps nobody has studied test-retest reliability, then the OMERACT working group itself can design a study, have that approved by the TAG team, and then go ahead and do that study, create the evidence, and include that in their summary table. But what type of evidence is actually needed? Well, we need evidence that can answer these two signaling questions. Do the numeric scores make sense? And can it discriminate between groups of interest? When we look into broader measurement properties, do the numeric scores make sense is represented often by construct validity. And the signaling question of discrimination is really made up of 4 properties. Reliability, be it test-retest or inter-rater reliability. Longitudinal construct validity, that is construct validity over time or responsiveness. Discrimination in a clinical trial setting, so when you put it in a situation where it has to discriminate between your two target interventions or your intervention and control, it's able to do so. And then thresholds of meaning, where we try to discern a score that's meaningful. For example, minimally clinically important differences, boundaries of error, or a patient acceptable state in a level of pain, for example. So when we're looking at a measurement property review, what we're really doing is trying to move through these steps. We want to do a systematic review of the literature to find all the studies that talk about the measurement properties of that instrument. When we've done that, we're then going to make sure that they've used good enough methods, which is reducing any risk of bias in how they've estimated those measurement properties. We're then going to check the findings. How did the instrument actually do? Was it good enough? And we have some provisional standards available for you to use for that. And then we move into the phase of synthesis, where we do a synthesis across all the evidence for each measurement property, and then across all the properties for an overall synthesis of how well the instrument as a whole did. So now we move into the step then of finding that evidence. The first thing you might want to do is gather the evidence from known resources. If there's a manual, if there's the developers available, can point you to some really key references for this instrument. And then also conduct a thorough review of the literature with a library scientist to help you. And when we do that literature review, we're going to do a Boolean logic. So we're going to have a search for all the measurement properties that we want to be able to include, a search for the population, and then a search for the instrument of interest and all of its acronyms or all the way it's been referred to in the literature. And then when we end those 3 searches, those 3 sets of search terms, we will find at the middle the target articles that we're wanting to find. But often you start off with quite a large body of literature to go through and screen, because there's a lot of studies that might say, oh, the numeric rating scale is a very valid way of measuring pain, but what we want is the study that has established the validity of that numeric rating scale, for example. So first we have to do some screening, and like any review, you screen out many articles by looking through the titles and abstracts. Is it about your instrument, your version? Is it about a measurement property? Or, as I mentioned, is it just something saying, oh, this is a valid instrument? So you want to exclude those and include when it's really about a measurement property study. So as we move through the search strategies, you may well find that you exclude quite a number of articles. We might have found 68 articles in our review that were flagged as being relevant for a measurement property study on the numeric rating scale. But when we actually looked at the full article, 57 of those were excluded. So that in the end left us with 11 articles for really doing the synthesis from it. And then on the right hand side you see a very important box, which is the new studies that were conducted to fill gaps. And the group did one study that was conducted to fill gaps, and that then gets added in for a total of 12 studies. But what happens now is that we need to identify which measurement properties were studied in each of these papers, because they aren't going to necessarily study the same type of measurement properties. So as you can see, as you're finally selecting, you do a full article review and you're in that final stage of selecting the key articles you need to review. We also will ask you to extract exactly which measurement properties the article looked at. And that's when you'll start to build what we call a summary of measurement property tables. So identify which measurement properties. It's done for each article selected, and this is just the options that will be available for you, which are the same ones we reviewed earlier. Face and content validity, feasibility. These are also asterisked here because they've already actually been completed by the working group, or you wouldn't be at this stage of doing the literature review. So when you're at the literature review stage, you know that your group has already felt that it has good face and content validity and it's feasible to use. But what you might want to do here is, if somebody else in the literature has also done this more formally and published it, then still include it in your review. But the 5 properties that we're really after are those of construct validity, test retest or inter-rater reliability, the clinical trial results, responsiveness or longitudinal construct validity, and that thresholds of meaning. And then we start to enter them into a summary of measurement properties table. And this really, you'll do lots of work and it all gets summarized onto this one table. And this is the final product, and what we're going to do is show you how we build this summary of measurement property table. The first task is to decide, as we mentioned, which measurement properties were in each of the selected articles. So we might take the methods section of the article and look to see what measurement properties they're looking at. So this is an article by Childs in 2005, and you can see I've highlighted in yellow the sections of this methods. We've clipped part of their methods from this article, and you can see the first section talks about the property of test-retest reliability. And then as we go lower, you can see that external responsiveness of the numeric pain rating scale is characterized by the area under the curve, and that's longitudinal construct validity or responsiveness. And then finally, they talk about thresholds of meaning at the very bottom. The minimally clinically important difference was determined, da-da-da-da. So they also looked at minimally clinically important differences. So in our summary of measurement property tables up at the top, you'll see that we start applying the X's to the boxes that are covered by that article. And this would be repeated for each of the articles. And so you can see that you start to develop a table here with X's in the cells that indicate where you'll find a piece of information for that measurement property and which article you'll find it in. You'll see that I've shaded over the first 2 columns, and that's because those columns are already decided upon. So now you might find evidence in there, but just keep remembering that you've already made a decision on these 2 properties before this point in time. The next task is to work by column. So you take each column and we'll be doing an analysis of the measurement properties by column. So sort of like 4 or 5 separate reviews. So taking everything that was in the column of construct validity, we'll then be looking and making sure that they've done good enough methods, and this is the quality appraisal. So in our table we had 1 study that looked at construct validity. When you go into the handbook and the workbook, you will see that there's questions for each measurement property that should be considered. So under construct validity, we can see that we're supposed to answer, was a clear description given of the construct measure by the comparator instrument? Were the measurement properties of the comparator instrument described and at least adequate? Were the design and statistical methods adequate for the hypotheses being tested? And was it otherwise using good methods? So we'll have two people review these questions and answer these questions for each article, and you'll see that you'll start to get X's aligned in the boxes. And if it has four, like all four are yeses, they used good enough methods, then you're going to answer yes, it's likely a low risk of bias at the bottom, in the bottom box. But perhaps if one or two of them was no, that specific criteria was not achieved, then you'll have to make a decision about whether you feel this is, we should go ahead and use this piece of evidence, but with caution, or no, we shouldn't use this piece of evidence because we can't verify that it's free of bias, or it might be at a higher risk of bias. So these colors are entered into our summary of measurement property tables for each cell that we've then tested. So you can see that most of them in this situation were green, so they used good enough methods. But there might be two there, for example, that are clinical trial discrimination, and they got an amber rating. So what we do then across the row is we start to tally up the number of articles that are supplying us with evidence. So the first row below all the colored boxes say how many studies were even available on this measurement property, and then the next one talks about the total number that would be available for synthesis on this property, the total available that had either amber or green ratings. And in this situation it's the same as the row above because they all had amber or green ratings. But you can imagine that if one of them ended up with a red rating, as I've just shown here, then the numbers would differ. So we have two articles that are potentially available for test-retest, but one ended up with a red rating in quality appraisal. So now we're down to just one article that we're going to use for synthesis. And it's important at this point to keep track of these decisions on your summary of measurement property evidence table and in your quality appraisal worksheets so that you can always go back and check it if you have any questions. So the next step after you've found the articles that have good enough methods to go forward is that you need to look at the results of that study. Did they actually show that the instrument did a good job or that it did a poor job? So for each study and each measurement property, you'll be adding a plus sign to indicate that it was good enough performance, and we do provide some provisional standards for you. A negative sign would mean that it actually did poorly. So it was a good study of test-retest reliability, and it showed that this instrument has poor test-retest reliability. Plus or minus is equivocal, and if you're not sure or it's unclear in the article what the results were, then you'd put a question mark. And that would be, you'd go back and review that in detail. So now you can start to see that we have pluses and minuses in our summary of measurement property evidence table. Now we're moving into the synthesis phase of our review. And remember our red, amber, and green. Same thing now. We have to come to a conclusion for all the cells that were in the column for construct validity or test-retest reliability. And we have to say for each measurement property, do we think the instrument did poorly, so it didn't perform well, which would give it a red rating. Green would mean that it was consistent supporting findings across studies that used good methods. White means that there was no evidence available, so there's an ongoing gap. And then all the rest would be given an amber rating, indicating maybe only one study or studies that had weaker methods. So again, it means we can go ahead, but you've got a caution. And at this point, we'd be asking you to set up a research agenda. How are you going to move this from an amber to a green? What more do you need to do to just check on this property? So here you can see across the bottom that we have the working group has decided that this is a green, green, amber, green, green, amber, green. Construct validity is rated as an amber because there's only one study available. Clinical trial discrimination had two studies, one with equivocal findings, one with positive findings, and so it ended up being an amber rating because there were weaker studies and one was sort of equivocal findings, so it's just a cautionary amber about how it could do in that situation. And in this situation, they would be providing some suggestions for what could be done to bring those up to a green. So we're moving all the way through our process now. You've done your literature review, you have it all compiled, and now we have to decide if that instrument has passed the filter. So at this stage we ask working groups to decide what they're going to be recommending to the OMERACT community. A green means a full endorsement, full slate of green across each of the measurement properties, and means that this instrument has clearly passed the OMERACT filter. Amber is a provisional endorsement. So if there are some amber ratings in your measurement profile, you'll need to give a provisional endorsement, which means let's go ahead and use it, but there's some things for us and the working group to get back to, check on, and then get back to us to move it up to a green. And then red would suggest that this instrument is not the right instrument for this need, so it should not be considered. And that again doesn't mean that it's a bad instrument for another need, but it's just not going to fit our need. So this is all recorded at the bottom of our summary of measurement properties table. So in this situation, because we had 2 amber ratings, we might give it a provisional endorsement. Let's use it, but there's additional work that needs to be done in order to move us up to a green rating. So at this point we're going to be asking you to bring it to a vote. Now at this phase in OMERACT, we're testing to see whether this can be done in a more expedited manner by having you bring it to the vote of the TAG committee. So the Technical Advisory Committee will review your work, make sure you have good standards for how you've approached the work, you have rationale for all of your decisions, those rigorous methods, and then we will be saying yes, that there is evidence on the table that supports your level of endorsement. And that instrument can then go forth. We'll be trying this for a few years to see how it works, just so that we can move a number of instruments through. So as a working group, in order for TAG to endorse your work, you're going to have to report your work to the TAG. And what do we want? Well, first we want your SOMP table. We want your one-page SOMP table, that one where you've kept the colors and the pluses and minuses, and it tracks all of your decisions. We're going to be asking for a 5-page, a narrative summary of each of the instrument's measurement properties. So a summary of the test-retest reliability studies, the construct validity studies, with just a bit of prose around how did they actually do the study, what was their patient groups, etc. And then 25 pages. And this will be your completed workbook. It likely is going to be longer than 25 pages, but we'd like you to include things like your PRISMA table to show your flow of your literature review and selection of instruments. We need to see the good method checklists, that you did it 2 people and you reached consensus on those methods. We need to see all of these details and have them available for us to review as we're reviewing your work. And be ready to let people know about your findings. You've just done a tremendous amount of work, so plan for some dissemination. Use your key stakeholders. You've involved them early on. Get them re-involved now. You have your findings. How can they help you get that message out about this work that you've done and the instrument that you've chosen? So again, as I say, voting is going to be done in a different way this year for 2020, that the Technical Advisory Group is going to be reviewing all of the submitted workbooks, and they will verify that there's a justification for your decision and the rigor of your methods. So you will not need a vote at the full OMERACT meeting in 2020. You'll just need to have the TAG team's endorsement of that work. We might be implementing presenting options so that OMERACT meetings in the future may have poster space available for endorsed instruments. So they will need to be done well ahead of the OMERACT meeting in order to let us know which instruments are coming and have been endorsed by the TAG. The summaries of all approved instruments will be made at the OMERACT meeting, and we'll have them up on our website. But the reviewing of the instruments will be done between OMERACTs. You're not doing this all on your own. So although it seems like we're setting you out and then we're sort of reviewing your work, we are actually working with you. So each working group will have the workbook for guidance. We provide you with search terms, selection criteria, the SOMP form. So we're really trying to provide you with a template for your work. And we'll also be putting in a mentor from the OMERACT Secretariat. So somebody who's on the Secretariat who can help you move through the stages so that you're not feeling that you're on your own. We'll call in people from TAG whenever that's needed. You will actually have tag observers on your team just to sort of keep track of how things are going for you and where we can improve our processes. So all of these people are in place to make sure it's a successful experience for you. TAG is going to have up to 6 instruments active at this point in time. So we're trying to streamline the flow of work through them. So if you're a working group and you're going to be engaging in this activity and we've held a space for you, then we ask you to keep really active. If you do need to become dormant for a while, that's fine, but we might ask you to stay in that dormant state while we let another group move in who maybe has been waiting to have their instrument approved. And what we'll be doing in this initial phase where the tag is doing these reviews is we'll be monitoring those volumes really closely to see what volume we can optimally manage. So we'll try to, there's not an opportunity here to answer questions, but we will try to do so. We've started a frequently asked questions thing under methods at the OMERACT website, so hopefully some of those will be there. You can ask more, and if they are questions that are of common interest, we will put them up on the FAQ page. So thank you very much for your time, and hope that this has helped you achieve the objective of understanding the instrument selection process at OMERACT.